Something that's really interesting about this conference, I think, is the range of topics, but also the range, like from somewhere like China to somewhere like Tasmania with a population. We're actually proud that the last 2 months we've reached 500,000 people. So a population of 500,000 with fairly tight resources. What I'm going to do, I'm going to talk to you a little bit about the Link Youth Health Service because we're not at the treatment end, we're not at the clinical end, we are at the prevention end, and very much the public, the community, particularly young people, education and prevention. Prevention's written in big letters in our minds and in everything we do. The link, I'll talk you through it. The building itself, we've got two buildings. One is on a main street with street frontage. We have GP, we have clinical services there. What we call the core, the engine room of the link is a little building. You can't see the laneway there, but it's down the end of a laneway in Hobart, in the city. Young people love sneaking in the laneway and coming to the service. The other thing about the link, a lot of the clients, we've got clients from young people living in the streets and doing it pretty rough to young people at private schools. So it is very, very broad, and we've managed to make it coexist without too much of a problem. It's mainly young people 12 to 24 that access us, and they could be accessing the service for a million things. They could be coming in just to get information for a school project, or they could be coming in to talking to someone about sexual health, or they could be coming in to access our needle and syringe program. But they can, who walks in and out, there's no label to that person. So being generic actually gives us, I think, the edge as far as being able to engage with young people, and also I think it makes it easier for young people to come into the service because they can't be labelled as anything. That building that you just saw is an open access area, so that's where any young person will come in. They'll talk to a generic youth health worker. They might. We've got facilities like washing machines, chopping a bit of it, but all right. We provide free condoms, lube and dams, washing machines, detergent. If young people want to access a health professional, we'll refer on. We've got a small fund that pays for some medical services that they can access, and we also for the ones that are homeless or have no fixed address, we've got mailing facilities. So the mail, things like Medicare, you need an address, but it's also another way to engage them, so they can come in for something, they can come in for mail, they can come in to wash the clothes. The prevention and the education side, right through the service, youth health workers will engage with the young people in a manner that's non-threatening, and it might be coming into the washing, but you can get into conversation with them about a whole lot of health issues. There's a couple of rooms which are, if a young person wants to speak to a worker in private, or they want to bring up an issue, which happens quite often, they just go into a quiet room and talk about it privately. There's no appointment needed. It makes it really easy. That's Steve on the background. Actually, he's from the UK. We've got a large range of information on health issues, and a lot of people access us for the initial information, so they'll come in as a gateway into the health service. One of the things that we've got, the needle and syringe program, we've gone beyond just it being an exchange. Brief interventions have gone from, they used to be around 30%. By brief intervention, I mean, just engaging with that person about a health issue. It could be the worker notices that they've got an injecting site that's might be infected, or about technique, injecting technique, sharing that sort of stuff. The last year we started actually budgeting for and buying things like tourniquets, filters. So, because with the tourniquets, it was actually interesting, the stuff about sharing and not just the needles, being the equipment. But we're finding a lot of young people were using belts or using, bits of a rope or whatever, and they were sharing that. The next person was using the same thing, so there could have been, blood-to-blood contact. They weren't even thinking about, they're thinking about the needle because there's been so much information about it, but not the tourniquets. The building that has the street frontage, we're lucky that it used to be a shop, so we've got two windows. One we're using for promotion of youth work, so works of art produced by young people as a public space, and also to get the local traders and that not to be too scared of them. They actually can do things that are quite productive and quite good, so they're not sort of just hoons coming in and injecting gear. The other bit of the window we use for health promotion. So if it's we might run different campaigns on quit smoking. Recently, actually, we had something on hepatitis, being Hepatitis Week, and that gets seen by a lot of the local traders, but it's also in the main shopping areas. So a lot of people, we're going to go with clickers one day. It's one of the things you can't measure the effect you're having, but a lot of people stop, and we do get a lot of comments about it. So it's an opportunity to bring out health promotion onto the street without it being too preachy. And we work very strongly in collaboration with other health professionals. In that building as well, we have got alcohol and drug counselling, but we've got a general practitioner that conducts vein clinics. So if we pick up any issues at the needle exchange, we can refer directly within our service. Normally, I don't know what it's like here, but in Tassie, to get to see a doctor, for me, it might be 2 weeks if my doctor's free. For a young person that, particularly the ones that haven't got any fixed address, it's hard to find a doctor that's going to see them, and if you get him in, it could be quite a while. By having a GP locally, we can get the young person to see a GP very quickly. We're lucky to have a brilliant GP, David Jackson. He's had a lot of experience with injecting drug users, and he relates really well to young people. And we also use that building for services like the Hepatitis Council that come in and can talk to clients. Health promotion, like I said, is health promotion and reduction of harm are really what are the cornerstones of what the link does. There are some of the displays in the window. The one on the right was about Mental Health Week. And because we're not experts at any of those fields, what we do is work very closely with the people that are. We've gone away from trying to be really good at everything and realising that no, what we are good at is identifying issues and bringing in the professionals to deal with those young people. So we try to work in collaboration as much as possible. A couple of years ago, we had a part-time Hep C worker. There were two funded in Tasmania. We had one, another organisation had one, both part-time, both not enough time to do anything properly. But it looked good because, the funding's gone there and boxes being ticked. What we suggested, and it happened, is like, look, we'll drop our funding. Let's have one worker in Hobart, in one organisation that we'll refer to. That worker, before she left, she identified, she did a lot of health promotion. She identified the young people. She couldn't find any good resources for young people that had the response she wanted. I mean, we've seen it here, and we know it because in health we're very good at charts and data and stuff that to us is important. And I'm one of those weird people that has got a passion for data.